We have R Venkatesh, the Group CEO at Narayana Healthcare, joining in on the show right now. Mr. Venkatesh, great to have you on the show. Help us understand what is the occupancy trend right now when it comes to your business.
So, quarter two always is a very good quarter in terms of occupancies. So, as for the industry standard, our occupancies have also been good. Um, while every healthcare provider is working aggressively on occupancy, we still feel that is just not the only determining metrics to measure optimal utilization. We're investing in technology, process, capacity, bottlenecking that helps us turn around patients faster and improve our discharges efficiently and eventually the throughput. So we work on improving discharge times before 2 p.m. so that there is no shortage of patients coming for admissions, improving throughput in ICUs, developing communication tools for the doctors and nurses to coordinate care faster, improving service delivery for better patient experiences, improving the turnaround time for our lab reports, diagnostic reports. There have been more than 40% improvement in the last 4 quarters. Appointment channels for all the patients through our own self-developed care apps, NH Care app and portal. More than 80% of all the appointments are done through that. The rapid process transformations, reducing the ALOS to less than 4 as per industry standard. And with this space we create, through these savings, these measures, we try to focus on infrastructural enhancement to address these patient bottlenecks, which is OTs, ICUs, adding more OTs, more ICUs, diagnostics, lab billing, etc., which will enable us to increase the patient volumes at the same cost levels. So we are also working very well in terms of occupancy. Apart from this, we would say that the occupancy is also hovering somewhere around 65 to 68%, but that's not the only measuring metrics. I've already mentioned very clearly the processes we are following in terms of improving the throughput, which is more important than just gauging occupancy alone per se.
Sure. But what about elective surgeries? Is there a delay in that, as was the case during COVID times?
There was a pent-up demand post-COVID in terms of elective surgeries, but there has been efficient throughput in terms of surgeries. And over the last 1.5 to 2 years, this, in fact, the year 23-24 has been the most stable and the consistent year in terms of a period post-COVID, where there has been more predictability in terms of planning for surgeries and things have been on course. There is no delay. Through our process efficiencies and efficient turnaround, we've been able to process all the patients waiting for surgery in a timely manner, and we would continue to do so in the coming days.
You have 70% of your business coming from owned hospitals. That means that your business is asset heavy. 30% is where you are getting managed services and other services. Could you be looking at reducing this number dramatically?
Over a period of time, we'll always have a combination of own models and asset-light models in terms of joint ventures with other partners. But the mix which we are following has been a very healthy mix, which has been time-tested, tried and tested, and the same mix will be eventually followed over a period of time. Of course, we would set up more of greenfield and brownfield initiatives in days to come. And the mix, we would continue to make sure that it is maintained in due course of time, or we are open to initiatives and partnership initiatives. But when it comes to the organization's plan and strategies, we would go more aggressive on greenfield and own models in due course of time. We have been very healthy in terms of our debt equity ratios in due course of time. We have done very well over the last 2 years. We have done aggressive expansions. We worked around more than 1,000 crores of investments over our greenfield initiatives last year. Even this year, we would be investing more than 1,000 crore in our greenfield initiatives, primarily on Cayman, Bangalore, and Calcutta. In spite of such investments, we would be staying healthy in terms of debt EBITDA and debt equity ratio.
Okay. So, I remember I've had the pleasure of tracking Narayana Healthcare, which has now become NH Healthcare for years now. What our understanding of the model a couple of years ago was that it will become asset light, it will always be asset, it will not be investing a lot in terms of creating fresh capacities. But off late, you're looking at expanding. That's what my understanding is. You're looking at adding new capacities and which are going to be more owned capacities. So is there a change in the strategy?
No, I see. You see, we continue to enhance our abilities to treat more patients, and bed addition is only one of the ways in which we do it. Bed addition is not alone a representation of the growth. We are investing in various capabilities. I've already said about how we improve our turnaround time, how we invest in technologies to improve on efficiencies. We will be able to sustain our organic growth momentum comfortably with this, and we'll also, till we get into our inorganic expansion. We're not saying that we won't purely only invest in capacity. Uh, we will also be investing in capabilities, which is like investing in equipments to improve the clinical capabilities, investment in our greenfield ventures, as I've said, to improve on capacity expansion. Whilst we look at a 30 to 40% expansion in our capacities in due course of time, we would put more emphasis on technology to improve our services and throughputs to patient for a better understanding. So while we say when we look at expansion, expansion just doesn't purely mean capacity building. It also helps. It also is efficiency building to improve the deliverables in healthcare, which will make a very big difference in due course of time in terms of how the patients look at us.
All right, good to have you on board. Thank you so much for taking time out and joining in and giving us a perspective as to how business is trending.